Now let's talk about the investigations of sarcoidosis. As mentioned earlier, the only imaging really done is a chest X-ray, which shows bilateral hilar lymphadenopathy. When performing blood tests, we see an increased ESR, lymphopenia, increased LFTs, which are liver function tests, serum ACE, which is angiotensin-converting enzymes, would be increased, but this is not a diagnostic test as it is seen in about 60% and is nonspecific. We also see increased calcium levels. There's also elevated CD4-CD8 ratio in bronchoalveolar lavage fluid. This is because of the CD4 T helper cells increased from the granulomas themselves. Pulmonary function tests will show a restrictive pattern. And the CT of the chest better demonstrates the extensive hilar and mediastinal adenopathy. And finally, tissue biopsy will reveal the diagnostic non-caseating granuloma. And this is what a caseating granuloma looks like, just for you to be able to identify one. And in sarcoidosis, we see a non-caseating granuloma. An example of caseating granuloma would be tuberculosis. Now, the staging of sarcoidosis is as follows, and it is based on chest radiographic findings. There's stage 0, which is normal. There's stage 1, which is bilateral hilar lymphadenopathy seen on the chest X-ray. Stage 2 is the bilateral hilar lymphadenopathy and peripheral pulmonary infiltrates. Stage 3, where we see peripheral pulmonary infiltrates alone. And stage 4, where we see progressive pulmonary fibrosis, in which you will see a honeycomb-like appearance on the lungs, which comes about due to the scar-like tissue. Next, we're going to talk about the management of sarcoidosis. The patients with bilateral hilar lymphadenopathy alone don't need treatment, as most recover spontaneously. As for acute sarcoidosis, bed rest and the use of NSAIDs, which are non-steroid anti-inflammatory drugs, which are used for treating pain, swelling, and discomfort, they're usually sufficient to treat acute sarcoidosis. Now, in some cases, the use of corticosteroids may be used to treat sarcoidosis. The indications of using steroids include parenchymal lung diseases, which can be symptomatic, static, or progressive, uveitis, hypercalcemia, and neurological or cardiac involvement. And usually, prednisolone is prescribed to these patients. Prednisolone, 40 milligrams over 24 hours, per oral for 4 to 6 weeks, and then you taper the dose off over 1 year according to the clinical status. Other treatments are also used at times in severe cases. These include methylprednisolone and immunosuppressants. However, this is beyond what you need to know as a medical student. So guys, that was a quick note on sarcoidosis. For more videos like these, keep watching sqadia.com.